morning and welcome to Our Issues Milwaukee. I'm your host, Andrea Williams. The holidays, of course, are right around the corner, and the number of new COVID 19 cases continue to surge across the country, including here in Wisconsin. With that said, millions of Americans are dealing with the effects of COVID 19. The unemployment rate remains very high, and millions report that their households did not get enough to eat or are not caught up on rent or mortgage payments. My first guest is Sherry Tussler, Executive Director for the Hunger Task Force, Milwaukee's free and local food bank, and Wisconsin's leading anti hunger organization. How are you, Sherry?
We're doing well.
Well, I appreciate you being here with me this morning. And like I said, there's a lot of concern amongst many people as we get closer to the holidays. And a recent analysis projects that food insecurity will hit 52 million people across the country due to COVID 19, which is an increase of 17 million from pre pandemic times, a crisis within a crisis. Easy to describe it that way, right?
Absolutely. We're seeing increased numbers at our food pantries, which are all drive-throughs right now. We're seeing more and more seniors in line at senior dining sites looking for extra food. Unemployment, as you said, is at record highs, and it's troubling to see so many people not getting their unemployment checks and struggling just to make ends meet.
Yeah. And as always, Hunger Task Force has been making a difference in the lives of people who live right here in our community. You've been doing that since 1974, but so many organizations like yours who really are there to help people are being affected as well. So, what are some of the ways that you've been affected?
We lost all of our volunteers back in March. And so our staff are doing the work that the volunteers once did, building the boxes, distributing the food in the parking lots. We've all had to learn new jobs. We've all had to pivot. And most of us are working a lot of hours at this point, and it's all in service to the community.
Yeah, absolutely. So, when you talk about making those types of adjustments, then you've had to hire more people to help you do the things that volunteers normally do.
We did because we needed to keep it a small workforce, but a tight workforce. We segregated all three of our locations. So some staff would report to one or the other, but we didn't intermix our staff. And the idea was to cut down on the likely spread of COVID if one employee got it. So far, we've been safe, and we're proud to say, knock on wood, that we're going to get through this. But we've made sure that we have kept that supply chain intact for people in need.
Yeah, and a lot of people are concerned for our seniors because even pre COVID, you had a lot of seniors who were unable to get out and really do their own grocery shopping, or they just didn't get enough support as far as from food share in order to get everything that they needed. So, have you been able to keep up the programs that you have set up for seniors, such as the stock boxes? And there's also your mobile markets and things of that nature.
Stockbox has continued through this entire COVID pandemic regardless. And so we're glad to say that we got that food out, but we were also able to match it with additional commodity foods. And so seniors are getting more food than they got before the pandemic. The mobile market continues to operate, and we're encouraging people to shop at it. We're letting one customer on at a time and cleaning it in between. We're providing masks and gloves to all of the seniors when we meet up with them.
All right, good to know. Talk a little bit about food share because I did just mention that, there are quite a few people who depend on food share and pandemic EBT is something we're hearing more about. Could you fill us in on that?
Sure. The food share program actually saw significant increases. We got the maximum allowable benefit per household, beginning with the emergency order. And then when the emergency order lapsed, we went for a couple months without that maximum allowable, but now it's back. And so a typical senior would get $16 a month in food stamps, and now they're getting $204 a month. So that's a super big deal. And that food stamp program, again, is the nation's leading line of defense against hunger. Pandemic EBT sounds like a horrible disease, but it's actually a food program, and it replaces the school meals programs. Pandemic EBT is a debit card that you get just like your Quest card or your food share card, and it comes from the Department of Health Services after they cross-reference your family's name with the Department of Public Instruction. So if your children were receiving free or reduced price meals in school, now they get a pandemic EBT card, and you use that money to replace those school meals by shopping at the grocery store.
Great information. So for those people who are watching, who would like to get in more information on how they can, in fact, take advantage of these things that are available, what is it they need to do?
They can go to the Hunger Task Force website and take a tutorial on how to apply for food share if they haven't. If they let their food share lapse because they felt that it wasn't dignified or they weren't getting a high enough benefit and they want to reapply, they can do that. They can also learn more about pandemic EBT because not every family got touched that should have been. Some families, the data just didn't match. And so if you got kids at home and they're hungry, you're probably eligible for pandemic EBT. Let us help you.
All righty. Well, we are, needless to say, counting down to Thanksgiving, and your goal, as always, is to help families put food on the table. So, how can those watching actually help you achieve that goal?
We have something really awesome that we did this year, and it seems to be working. We have the virtual food drive. So you
Mhm.
won't see the food drive barrels at the grocery stores because we can't have people running around picking them up. But instead, you can go online at hungertaskforce.org and you can give a turkey, or you can give a whole meal, or you can give one of the elements of a meal, like the canned vegetables. And it's simple, it's easy to do from your home, and you don't have to take any risks at all. But people need the help. And if you do it, you can go to bed tonight knowing that you helped a neighbor.
Yes, and I love that you've been able to really take this pandemic and look at ways that you can still help make a difference. You just did a big drive-through food donation, and you've been doing some other things to help get that food in for the holidays. And I think it's amazing what you guys have been able to accomplish through this pandemic.
We've literally distributed twice as much food during the pandemic as we did at the same period in 2019. So 12 million pounds of food have
Wow.
gone out of the Hunger Task Force stores. If you drive by, you'll see semi-loads full of food sitting in our parking lot. So people should be assured that there is food at the food pantry, but they also should know that they can get food at the grocery store if they apply for that pandemic EBT or food share.
All right. Is there anything else as we wrap up this segment, Sherry?
Just want to remind people that Hunger Task Force is here to help, and we are in service to the community, and it has been an absolute joy to be able to help others.
Well, I speak for many when I say thank you for all that you do, and continue fighting the good fight.
Happy Thanksgiving.
Same to you. Sherry Tussler is the executive director of the Hunger Task Force. For more information on anything that we've discussed today, visit hungertaskforce.org. And when we return to our Issues Milwaukee, we'll be joined by a doctor from the Medical College of Wisconsin who will give us recommendations on how to stay safe from COVID-19 during the holidays. We'll do that right after this.